Hello everyone, welcome back to our channel. So in this video, I will be talking about the stroke and its causes. So this stroke basically occurs when the blood supply to part of the brain is interrupted or reduced, and it prevents the brain tissue from getting the oxygen and nutrients it actually needs. Now there are basically two main types of the stroke. One is called as the ischemic stroke and another is called as the hemorrhagic stroke. So we will be talking about these two different types of the strokes. So we know that the brain cells they actually begin to die within minutes that can lead to long-term disabilities. Now coming to this ischemic stroke, this is actually the most common type of the stroke that accounts for about 85% of all the strokes, and it leads to the formation of different blood clot that narrows the arteries in the brain, and sometimes it can travel from another part of the body that can lead to embolic stroke. So here you can see that how actually this stroke happens and how actually it damages the cells and leading to the disability for the long term. So we can say that this stroke, for example, in terms of the hemorrhagic stroke, this happens when blood vessel in the brain, this actually bursts and leads to the bleeding. So we call it as the hemorrhage that may be in or around the brain, and different causes include high blood pressure and sometimes blood vessel malformations. Now there is also a transient ischemic attack that is known as the TIA, and we often call it as the mini stroke. While actually blood flow to the brain is temporary, it actually is blocked temporarily but resolves within minutes to hours without any permanent damage. Now we have to see what are the different causes and risk factors that happen. So firstly, the risk factor is the high blood pressure. So this leads to the stroke and it can damage blood vessels in the brain. Atherosclerosis, where plaque formation happens in the arteries, this can also be the cause. And sometimes heart diseases, diabetes, smoking and obesity and sedentary lifestyle, these can also contribute to the stroke. And also the use of excessive alcohol, this can also lead to the formation of the stroke, and different family history and age can also contribute to the stroke. And early treatment is actually crucial for minimizing stroke, and we can say that making it important to recognize the symptoms like sudden numbness, confusion and difficulty in speaking or loss of balance. These are actually the signs that we can see. So this was all about this topic. Hope you have enjoyed this video. Thank you.